Hello and welcome to today's Health Affairs Professional Development session on career paths in global health and humanitarian work with Rabih Torbay. I'm Jessica Bylander, a senior editor and correspondent at Health Affairs. We're delighted that you're all joining us today. These professional development sessions were launched to offer early to mid-career stage professionals how-to tips for scholarly publishing, peer review, and enhancing communication skills to build your profiles in academia, traditional media, and social media. Before I introduce today's guest, I have a couple of housekeeping announcements. Members of the audience are encouraged to keep cameras on during the Q&A portion of the program. We kindly ask that guests make sure your full name is visible on the screen and in the participants list. You can change your listing by hovering over your name in the list, clicking More, and then Rename. This will help identify you. Questions may be submitted by raising a virtual hand in the Reactions tab or in the chat. You do not have to wait for the Q&A period to type in your questions, and feel free to enter them in the chat at any time during the presentation. Finally, the event is being recorded and will be published on the Health Affairs website. Today, we're grateful to be joined by Rabih Torbay, the President and CEO of Project Hope, a global health organization dedicated to providing lasting solutions to health problems with the mission of helping people help themselves, including medical training, health education, and humanitarian assistance in more than 24 countries. Project Hope is Health Affairs' parent organization. Since becoming Project Hope President and CEO in 2019, Torbay has elevated the organization's mission and involved its global health, humanitarian response, and sustainable development programs. He leads a global team of over 1,000 people implementing 64 active programs across more than 25 countries. With that, I will start the conversation and then open it up to questions from the audience after our initial conversation. So thank you so much for joining us. I wanted to start off with some questions about your early life and career. So you grew up in Lebanon during its long-lasting civil war, eventually studying civil engineering at the American University of Beirut. Tell me about your childhood. How do you think those experiences led you onto your current path?
Jessica, it's good to be with you. And thank you for that question. Usually people are not interested in my childhood. As you mentioned, I grew up in Lebanon during the Civil War. I was 4 years old when the war started, and I left Lebanon when it ended after I graduated. And it was really brutal civil war where we lived, we were displaced from our homes. We lived from day to day, not knowing what tomorrow would hold. And during that, we tried our best to live as much as we can and really take it one day at a time. But if it taught me something, it taught me, the value of life, how to appreciate life as much as possible, and that nothing is guaranteed. And during that war as well, there were a lot of issues in terms of lack of food, lack of medicines, education. We used to go to schools behind sandbags just to protect ourselves from shells and missiles. And that really shaped me in terms of knowing, how to appreciate it and how to appreciate life and knowing how to survive. I studied engineering. It wasn't my first passion. I've always been passionate about medicine. But being a teenager, I was also stubborn. My parents wanted me to study medicine, so I decided to study engineering, and here I am back in the health field.
Mm-hmm. Great. So you went to the engineering path, and then after graduating college, you worked as an engineer in Freetown, Sierra Leone. So I'm wondering what brought you there, a country also in the midst of its own civil war, and what did those years teach you?
I wasn't chasing wars. Just you mentioned 2 wars in 2 questions. I wasn't chasing wars. I went to Sierra Leone initially for 2 weeks after I graduated from college. And when I was there, I got offered a job as an engineer. There was an Italian company that was interested in having an engineer there. And I loved the country. It's a beautiful country, even though it was going through a civil war. So I took the job. Being fresh out of college, I couldn't believe that somebody would offer me a job in a couple of weeks. And it was a great job. I got to do what I studied for and, what my parents spent their money on. But I never really connected. My heart wasn't in it. I did the job. I did as best as I could. I grew the company. I started my own company. But something in me, not knowing what it was, kept pulling me away from engineering. And I did engineering work in Sierra Leone for 7 years. I mean, I was planning on being in the country for 2 weeks. I ended up spending a total of 9 years, 7 years of which I did engineering work.
Yeah, you mentioned growing the company. I thought it was so interesting that after rising to the role of manager of that construction company, you made what seems to me a very big and bold leap. You used your own personal funds to establish the first program in Sierra Leone for a US-based humanitarian aid organization called International Medical Corps. So how did that leap come about?
During the civil war in Sierra Leone, I mean, we all witnessed some of the world's worst atrocities. People dying, people getting killed, children getting killed, women being raped. And I witnessed all of that when I was doing my engineering work. And I really couldn't do much about it, because construction, all we do is rebuild after the destruction and try to set the country on a path for development. So when this opportunity came up, I wasn't looking, I wasn't planning, I didn't know much about the humanitarian world or the development world. And this opportunity came about and I decided to do it. I decided to volunteer for 2 weeks and really help them get started in Sierra Leone because I knew the country very well. Not knowing that I'm going to be sucked in and 23 years later, I'm still doing the same work. And what I found in it was how much little effort and little money can impact people's lives. When I first started, I went to an island called Tasso Island, just outside of the capital, Freetown, and there was a cholera outbreak. And I'll say it right now, I had no idea what cholera was. Again, being an engineer and not being in public health, I didn't know what it was. We went to this island and there were so many people dying every single day simply because they had no medicines, no medical supplies. The clinic was destroyed. And I remember walking into the clinic and there was a nurse there. And the nurse was actually sleeping. He was sleeping. He was drunk. And there was a kid, a baby, I think he was like 2 or 3 years old at the entrance of the clinic when I walked in. And I went and spoke to the nurse. What's going on? Why aren't you doing anything about it? And he said, I have no medicines, no medical supplies, no equipment. All I'm doing here is seeing people die. What do you want me to do? I'd rather be drunk and not see that. And by the time I walked out of that clinic, that boy that was there when I walked in was dead. And this is what made me decide that, you know what, I want to do something about it. So I used up my own money to fund, to buy medicines, get a couple of nurses and a doctor, and get, some hygiene people, and used my engineering background to start an intervention on the island. And the mortality rate went from 100 a day, and this is an island of about 10,000 people, to 2 deaths a day within 1 week. And in 2 weeks, there were no more deaths. And the investment, the total investment was less than $7,000. Wow. So this, you can imagine the impact that had. And once I saw that, I knew I wasn't going to go back to engineering work.
Right. I think it'd be interesting to sort of see where you started in humanitarian work kind of and where you ended up today. So what were you focused on in your early days as a country director?
It's funny, being an outsider to the NGO world and to global health and humanitarian work, nobody had any expectations that I would actually succeed. And I guess I wanted to prove them wrong. I wanted to prove them that even though I have an engineering background, I'm not a medical doctor, I believe that hard work and learning as you go would take you places. And that's how it started with me in Sierra Leone, with really nobody believing that I could do it. I started working, I hired people that are much smarter than I am, which is something I've always done all of my life. And it worked. And the program in Sierra Leone grew from the $7,000 I initially invested to close to $10 million a year with funding from US government, from the British and other donors. And really we focused on growing primary healthcare. And the one thing I've learned in those formal years, as I call them, is that communities where we work, they know what they need. They know what they want. And what we do, what we should be doing is really asking them and supporting them. Let's not pretend that we know the solutions better than they do. They know the solutions, they just need the help and the support. And this is what we did. And the program in Sierra Leone grew quite a bit to the point where the organization became the largest organization in the country.
Yeah, I want to talk more about sort of putting it in the hands of the community in a minute, but just continuing to track, your work then took you to Pakistan and Afghanistan in the wake of 9/11. What brought you there?
Yeah, I guess my old organization had a habit of rewarding people in a very weird way. I think I did such a good job in Sierra Leone. I was hoping that I would actually move to Los Angeles, where they were headquartered. And that was the plan, except that I flew to London and I made a detour from London to Pakistan and Afghanistan after 9/11 to do the same thing, to launch the emergency response, in the wake of the Taliban pulling out, Northern Alliance coming in, and, organizations having access to populations, which we didn't have before. So I did that immediately after 9/11. I was in Pakistan, then went to Kabul in Afghanistan, when the Taliban was still in control of Kabul, but they were pulling out. And we started health programs there immediately in Afghanistan. We brought women from Pakistan to Afghanistan, especially physicians, because Afghanistan desperately needed female physicians. So the female physicians came from Pakistan and Afghanistan. All of them were Afghan female physicians, and started the first maternal and child health program in Afghanistan at that time, when it was desperately needed. If you remember, under the Taliban, women have no rights. They don't have access to healthcare. They don't have access to education. So all of that was opening up. And once the program started, I did go back to Sierra Leone for a month to wrap up and bring my family. So my family was with me in Pakistan. They came with me to Pakistan, and I was working in Pakistan and Afghanistan for about a year. And I got the chance to really go all over Afghanistan, travel all over the country, see the beauty of the country, and see what Afghans have gone through over the, under the Taliban, and before that, during the Soviet invasion in Afghanistan, and see the potential of that country, but also the potential of the people in Afghanistan. So I spent a year there just doing that work and growing the program in the country as well.
Well, it sounds like a good detour. And then you did end up back in the United States, working for IMC in the United States as Deputy Director for International Operations and Director of International Development. So what was it like then working for an international aid organization from the US side? Was there kind of an element of culture shock, or did you miss being on the ground?
I mean, it was a double culture shock. Coming from Afghanistan to Los Angeles, that in itself was a culture shock. And working in the field to working at headquarters in itself, it took me a while to adapt. But during that time, I kept my focus. And it was one of my conditions for moving to headquarters, that I would still want to go out to our field programs and support them and lead emergency response teams. Because I strongly believed then, and as I do now, that our job is to support our field programs. Our job is to empower our field programs and our health workers throughout the world. So with that, knowing that I can still go back, and I did go back multiple times to different, emergency response throughout the world, really kept me grounded in terms of, even though I'm at headquarters, I'm there to serve our programs in the field, because at the end of the day, they're the ones saving lives, not us sitting at headquarters. Mm-hmm. It was a change, working in LA, having worked in the field all of my life. It was a bit of a change in terms of mindset, in terms of priorities. Time zone was always a killer between LA and the field, whether it's Africa or Asia. But I liked it. And I really started a trend of getting people from the field to come and work at headquarters, because that changes the mindset as well of what headquarters is, and also for the field to understand that headquarters could play a really critical role in their growth.
Mm-hmm. So from there, as your responsibilities grew and continued to grow, you reached the level of Senior Vice President. I'm curious, was there anyone you would turn to, a colleague or a friend, to help you navigate kind of the increasing levels of responsibility you held?
Many. I mean, not just one, many. And I had a mentor who had been with the organization for a number of years, and I'll reach out to him anytime, and he was very open and he was very patient with me. I mean, I had some of the dumbest questions anybody could ever have, and he was very patient and he helped me. But I knew coming in that there's so much that I do not know. And unless I ask people questions, no matter who they are, unless I ask and learn from them, I'm not going to go places. And I was ambitious in terms of really growing in the organization, but also growing the impact of the organization. So I had that mentor to always fall back on anytime I had something difficult. But I learned so much from everybody I worked with, whether they reported to me or I reported to them, or they were my colleagues, or even our beneficiaries in the field. I mean, this is where you learn a lot, our health workers and the people in the field. When you go and talk to them and really hear their story and hear how they survived whatever adversity they were going through, that's a lesson for all of us. And I really learned from them. But the one thing I've learned as well, and I mentioned it before, Jessica, is that I've always believed that my job is not to be the smartest person. My job is to really surround myself with people that are much smarter than me. And it's worked. I mean, it's worked every step of the way.
I love that advice. So fast forward to 2017, and you leave that organization that you've kind of grown up with to join Project Hope. What influenced your decision to take that next step in your career?
Yeah, I've known Project Hope actually since I was in Afghanistan in 2001, 2002. Project Hope was working in Tajikistan. They were the lead agency doing TB work in Tajikistan. And I really got to see the program and love the work that Project Hope did. And I kept in touch with the leadership. We meet in different meetings in Washington, D.C. And in 2016, towards the end of 2016, the board of directors and Dr. Tom Kenyon, who was the president and CEO, asked me if I would come and help them reshape their Gifts in Kinds program at Project Hope as a consultant. And I thought I was going to take a year off, and I didn't. I ended up taking only a couple of weeks off, and I got myself back into working. And when I came and saw what Project Hope was doing and the potential that the organization has and the people that were working for Project Hope, I fell in love. I mean, I was consulting for a couple of weeks, and when they came back and asked me if I would be willing to join in as a president with Dr. Kenyon and the board, I think it took me like 5 minutes to say yes, because the team, the work that we're doing, the potential of the organization, we're all there. We just needed to fix a few things to really get us going on the right track.
Yeah. So it's remaining with us in the same field, but I'm wondering if there was anything about the new role that took some getting used to.
Everything. I mean, from being a field person with a whiteboard behind me to suddenly being, an executive of an organization, the expectations are much higher, especially, where we're as an organization where we're dealing with some issues, transformational issues, but also strategic issues. The expectations were high. And at the same time, the pressure was there to perform, right? You come in the new kid on the block, although I wasn't a kid anymore, but the expectations were high to perform. And every day where we did not perform as we should have is a lost opportunity for us to impact people's lives where we work. So that pressure in itself was really there. And I had to learn how to be an executive with an organization, but at the same time, how to remain true to myself, being a field person, love to wear my jeans, not a suit every day, and being accessible to everybody. And that balance, I struggled with. But again, I had Dr. Kenyon to go back to our CEO and ask him for advice, because he's been in my shoes before, and others as well. And that helped me navigate the whole transition. 5 years later, I'm still learning. Every day I learn, but it's been really just one day at a time, understanding what it takes to get to the next level.
Mm-hmm. And Project Hope is an older organization. So what changes did you hope to make to its mission and vision? And would you say you've succeeded?
Project Hope is over 60 years old, and that's always a plus and a minus. It's a plus because you have a lot of history, and you have a lot of expertise and experiences, and a lot of programs that you've achieved as an organization over 60 years. And the minus comes with the fact that certain things we've been doing them the same way for 30, 40, 50 years and 60 years. And the world around us has changed and we have to adapt. And if you don't adapt, you'll be out of the, out of the picture. And for me, that was the main challenge in terms of how to bring Project Hope to the 21st century. The talent was there, the will was there, it's just the mechanics. And, really reviving Project Hope's reputation. We were one of the largest NGOs in the world in the 60s and 70s and 80s and 90s. And then we kind of grew smaller over the next 10, 15 years. And really getting Project Hope to become again a leading global health organization was the goal. We worked very hard, the entire team worked very hard. And we obviously rebranded the organization at the beginning of my 5 years. We have a new strategic plan. We really changed our approach to certain things. And whether it worked or not, I think it worked to a certain extent, but I cannot take the credit for it. I mean, the team done amazing work, but we are now a much larger global health organization with a larger impact. And whether it's the host governments, the ministries of health, or other organizations or the donor community, they appreciate what we're doing and they're coming to us and asking us to partner. And that's always something that you'd love. When people come and ask you to come and work with them, that's always a sign of success.
Yeah, I've been with Health Affairs under Hope for quite some time, and it's been really amazing to see the growth of the company. So with so many global threats to health, unfortunately, from climate change and its impacts, pandemics, infectious diseases, what keeps you up at night?
Everything you listed, plus some. I mean, pandemics. We've been talking about pandemic preparedness, for years at Project Hope, way before COVID. We've learned from the Ebola outbreak in West Africa that the world is so interconnected that you cannot really ignore what's going on in the world. And we've been advocating about pandemic preparedness and response since then. And the world, unfortunately, wasn't ready for COVID. And we've dealt with it as an organization as best as we could in terms of responding in China, where we've been for over 30 years, or responding here in the US and globally as well, with training, with supplies, with programs. But the challenges, they're always there. The needs are all over the world. We've seen what's going on in Ukraine right now. What we're not talking about is the impact of Russia's war on Ukraine globally. I just came back from Nigeria and Ethiopia, where I've seen what's going on. For example, in Ethiopia, there's a drought due to climate change. They're facing their fourth consecutive drought year or failing rainy season. There's conflict. There's an increase in prices for food, for oil, for gasoline, for anything that would keep the country going and for people to stay healthy. And we're seeing malnutrition rates among pregnant women and children skyrocket. We are getting to a tipping point throughout the world, but mainly in the Horn of Africa, that if we don't do something now, we will be facing a major famine. So we're trying to raise the alarm bell for people to know that there's something going on that we need to address. And that's a global problem. So what keeps me up at night is another pandemic, and we're still not ready for it. Because I've learned over the past years that once the emergency is gone, we tend to forget about it and we don't always learn from it. So we're trying to be ready for whatever might happen again. And the food security or food insecurity throughout Africa and frankly, all over the world. I mean, the wheat that comes from Ukraine and Russia impacts the entire world. And since that's not being exported, people are struggling. But also that impacts the sunflower oil that people use. It impacts the price of gas. I mean, the price of gas here in the US, that's the same all over the world. When I was in Ethiopia, people couldn't even afford to take a taxi to come to the hospital to collect their HIV medicine. They couldn't afford food to take with their HIV medicine. So you can imagine the impact, not just in terms of the emergency side, but on people's lives, on their daily life. And this is something that definitely keeps us all awake.
Right. And you mentioned Ukraine, which I know occupies a lot of your time and energy right now. So over the course of this year, the crisis has evolved into a widespread humanitarian catastrophe. Can you tell us more about how Project Hope is responding?
We had been watching the buildup of Russian troops along the Ukrainian borders since it started. And we were all hoping that it's just a bluff, that nothing's going to happen. Russia won't be crazy enough to invade Ukraine. And on the 24th of February, when Russian troops actually entered Ukraine, we decided to move immediately. We had been preparing, we had been putting teams together, and we deployed our teams to Poland, Romania, and Moldova initially, knowing that ideally we want to be inside Ukraine because that's where the needs are at their highest. And we've managed to do that within a week of being on the ground in Poland, Romania, and Moldova. We sent a team to Ukraine and we started sending medicines and medical supplies into Ukraine, but as well as to the neighboring countries that were receiving a large number of refugees. And we've seen the needs grow, not just for medicines and medical supplies, but also mental health. I mean, you can imagine when a woman and a young child say bye to their husbands in Ukraine, not knowing if they're ever going to see them again because the husbands are staying behind to fight, or their parents, and families are being separated from each other. So we started looking at mental health and addressing mental health issues, protection of women and children. I mean, we know that Poland and Romania and Moldova and all the neighboring countries did a tremendous job hosting Ukrainian refugees, but there are always bad people in this world, and we want to make sure that people don't take advantage of the vulnerable women and children that fled Ukraine. So we targeted that. And at the same time, we started sending additional medicines and medical supplies to pretty much to the war front in Ukraine. And I had the opportunity to visit Ukraine. I went to Lviv and Kyiv, the capital, and a couple of areas outside of the capital in early April. And I saw the destruction. I saw what was happening there firsthand. I saw attacks on hospitals where they were being destroyed, even though they had red crosses all over the hospitals, so nobody could shell them or attack them. They were being directly attacked. I saw mass graves in Bucha, where 267 people were killed and buried in a mass grave after 11 days of being on the street. So I saw humanity at its worst, but also I saw humanity at its best. I went and visited a hospital in Kyiv, and doctors and nurses had been there from the day the war started, and they never left. They've been there for 24 hours a day, 7 days a week. They never left. They took turns cooking and cleaning and helping each other out. And all they wanted to do was to help their own people. And they were all very appreciative of the work that Project Hope was doing, because a lot of the medicines and medical supplies that they had, it's things that we sent to them, that we supported them. And when you see that kind of commitment from doctors and nurses, you cannot but commit to doing more in Ukraine to help them. So our work in Ukraine continues. We have 4 offices that we are setting up throughout the country. We have a large team, and we're not just focusing on medicines and medical supplies. We're training trauma surgeons. We're focusing on infectious diseases. We have mobile clinics going to areas where hospitals have been destroyed. And we're also looking at the war injuries and how many people have been injured, and see what kind of rehabilitation is needed, for those. But Jessica, even if the war ends today, our work in Ukraine will be needed for at least the next 10 years to rebuild the healthcare system. So we're committed to staying there for the long haul.
And just what was it like being on the ground again, and why is it important to you to see that with your own eyes?
I mean, for me, it's important in so many different ways. Going back to the first question you asked me, how was it like growing up in Lebanon? It was exactly how I saw it with people in Ukraine, going from shelter to shelter, being displaced, losing their relatives. So for me, it was also personal, going back and seeing what I can do to help, not myself, but the organization. But also wanted to see the impact of our work and what else is needed on the ground. And I always believe that if you want to lead, you have to be willing to go out there and be the first one on the ground. I wasn't the first one on the ground. We were the first group to get to Kyiv and provide the services there. but also it reconnected me to the work that we do, because during COVID, we didn't get to travel much. So it was 2 years of frustration sitting behind a screen and not being able to travel. And I get my passion, I get my energy from the work that we do in the field. So for me, even though people in Ukraine might think they benefited from my trip, and that's what they believe, I benefited a lot from going out there, seeing the work that we're doing, and really recommitting myself to the mission of Project Hope.
Yeah. I want to talk about what we mentioned earlier about the community and localizing and decolonizing aid. Tell me more about what this means and how you're working toward that goal.
I mean, this is what we're hearing about more and more, and it's about time that people realize that aid has been a form of colonization to a certain extent. We at Project Hope strongly believe that the solution is on the ground. Communities know what they need. Our job is to support them and phase ourselves out of the picture. Mm-hmm. And by empowering local groups or the Minister of Health or local health workers or local NGOs, you give them the power to decide what is in their best interest, instead of us who are thousands of miles away deciding what is in their best interest. I mean, that had been their approach for a long, long time within the aid community for decades, and it needs to change. We cannot do that. We cannot replace those people. We're not the saviors. We're there to support them. And for us as an organization, if you look at who we have throughout the world, you'll hardly find any expatriate running a program. I mean, I went to Ethiopia, and the entire team is made out of Ethiopian professionals that are doing amazing work, and no foreigner can actually do probably 50% of the work that we're doing. Why do we want to be there? They know the priorities, they know the culture, they know what's needed. For us, we just need to support them. And I strongly believe in creating local community-based organizations or nonprofit organizations at the local level and fund them to do the work. I mean, we're doing that in so many countries now, where we have local chapters of Project Hope that are getting funding, they're doing the work themselves. They come to us once in a while for technical assistance or support, and we do that. And the idea that all the money needs to come to international NGOs and for us to decide what goes in every country, that's absolutely wrong. I fully support the decision to really spend a lot of our resources on supporting local NGOs and funding them directly. Our job is to build their capacity and build their systems and let them run with it. And this needs to happen more and more.
And I'm going to continue my questions and conversation, but just as a reminder, if folks have questions, you can enter them in the chat, or you can raise your hand using the reactions tab. And I'm not sure if I can see the hands, so if somebody could help me out if there are any hands. But my next question, it's just been a pleasure for me to work with you as part of Project Hope's Diversity, Equity, and Inclusion Council, which was created in 2020 in the wake of the murder of George Floyd. And we know that DEI is a long-term goal, that success won't be achieved overnight, and that it's not enough to say you're focused on DEI. So I'm curious what your ultimate goals are for diversity, equity, and inclusion at Project Hope.
Well, first of all, you're not going to get away by just mentioning that. I need to thank you and Leslie for leading the DI Council at Project Hope. You've done a tremendous job really getting it started and getting it going and have specific goals. My ultimate goal is to actually have no need for DI Council at Project Hope. For diversity, equity, and inclusion to be organic within the organization, that we don't even have to think about it. We're working on diversifying the workforce of Project Hope, the leadership of Project Hope, the board of director of Project Hope. But diversification alone is not enough. Inclusion is critical as well, making sure that everybody's part of the decision, making sure that people are heard and people are, contributing to the organization is what we aim for. And it's not just, we've had this discussion multiple times. our council is not just there because it's a trend. It's because it's needed. And because we believe in the fact that when you have a diverse group of professionals working for an organization, you've got different perspective, you have different input. It changes the entire structure of the organization and the entire thinking process of the organization, which is what we want. I mean, it's not just Project Hope, the entire industry needs to wake up, and they need to start focusing on really making sure that DI is not just something that we say, you know, to say we have a DI council, that's enough. If we do not focus on diversity, equity, and inclusion, and really make that part of the DNA of the organization, we're not going to get better. We will keep doing what we've been doing over the past 20, 30 years the same way. We can't afford to do that. I mean, we all face, you know, we all see what's going on in the country. We all see what's going on in the world. And if we don't take action internally, we cannot preach externally. So for me, the ultimate goal is for the council to no longer be needed within Project Hope.
Yeah. As you mentioned, we're faced with threats to equity pretty much every day, from the recent loss in the US to a constitutional right to abortion, to experiences of racism across the globe. And it's easy to feel powerless. What do you feel people can do in the face of threats to equity and health equity?
Two things. First of all, continue to be vocal, because if we're not vocal, people will get away with it, and take action, no matter what the action is. Just take action, do something about it. It's not enough to talk about it, it's do something about it. As individuals, as organizations, as a group, no matter which way you want, just take action. Otherwise, I mean, we're seeing it over the past couple of years, just one thing after the other, right? Whether it's the mass shooting that keep happening, or, you know, the overturn of abortion laws, or what we're seeing in terms of, you know, COVID funding now disappearing. I mean, we're going back to getting ourselves in trouble over and over again. And the most important thing for me is to take action. You know, one of the things I always tell my team is that make a decision and take action. If it's wrong, you learn from it, and you move. Nobody's going to get fired for making a wrong decision. Inaction and not making any decision, not taking any sides, is actually what gets people in trouble, and it's unacceptable. I mean, when you talk about genocides, they happen because of people stand by and don't do anything about it. They don't talk, they don't do anything about it. I'm not comparing this to a genocide, but the action is really critical in any movement. And no matter what that action is, just take it.
So health affairs represents kind of a different side of the Hope work and mission. We're usually behind our desks, maybe taking action with words. So what role do you see health affairs playing in supporting Hope's mission?
I mean, first of all, health affairs is just doing an amazing work in the US in terms of health policy, in terms of raising some of the issues that people are not raising enough, whether talking about health equity or racism or you know, non-communicable diseases or gun violence. I mean, there's so much that's being brought to light by health affairs that's incredible. In terms of, you know, how it contributes to Project Hope, I mean, we have a strategic plan, and one of 5 strategies that we have is health policy, both domestically and internationally, and that's the role that health affairs plays into, you know, at the domestic level. But also, we're seeing more and more work now talking about what's going on, you know, globally as well. We're seeing the impact of what goes on globally in the US, and therefore we're becoming more interconnected. And health affairs, you know, is the leading, and I know I'm biased because I love health affairs, but it is the leading health policy journal in the US. And if we do not take advantage, if the entire health industry doesn't take advantage of what health affairs is publishing and what we're talking about, they're missing out on some major opportunities to impact change in the US and globally. So I mean, this is the first thing I do when I go to meetings because not everybody knows about the link between Health Affairs and Project Hope. The first thing I say, hey, do you know that Project Hope actually published Health Affairs? And then you see a complete change in the mood from the audience I'm speaking to in the US, especially here in Washington, D.C., because everybody knows Health Affairs and the impact it has.
What do you want people to know about the current state of global health and humanitarian affairs?
We're in trouble. We are in trouble, and there's so much going on between conflict, whether it's Ukraine or Ethiopia or Nigeria, I mean, or what's going on in terms of displacement in Venezuela. Climate change and the impact of climate change on health is critical. We don't always talk about it, but the impact of climate change on health in terms of disease spread, in terms of displacement of populations, fleeing drought areas going to water. I mentioned Ethiopia in terms of, malnutrition and what's happening. The impact of climate change on health is an existential problem that we need to deal with jointly. This is not a political statement. This is not Democrats or Republicans. This is a fact that we're living every day. And we need to all address that and work on it together. Pandemics. I mean, we're still dealing with COVID. We don't hear about it much, but we are still dealing with COVID globally. And who knows what's next? We have to be prepared. The entire international community has to be prepared to deal with the next one. And it means investment. It means localizing and not have everything sitting in US or in Washington, D.C. or Atlanta with CDC or London or France. We need to localize and really support local governments to to detect and deal with the situation early on. And we need to train people. And one of the biggest problems that we haven't spoken about is the lack of health workers globally. I mean, we're seeing shortage of nurses here in the US. You can imagine what we're dealing with at the global level. The estimates are about 18 million people or 18 million health workers will be needed by 2030. And that's a major shortage. I mean, we're talking about a shortage of 18 million health workers. How are we going to produce this? Unless we come up with a plan, a global plan to address the shortage of health workers at every level, whether it's the doctors, nurses, midwives, traditional birth attendants, community health workers, we're in for a lot of pain globally and here in the US. I mean, you go to any hospital here in the US, you see nurses from Africa, from the Philippines, from the Americas, from Europe, because we have a shortage here. And those that are coming from those countries, they're leaving a gap behind. We need to fill those gaps, because if we don't fill those gaps, we're gonna feel it here at home. So those are some of the things that are major global health priorities that we need to focus on. And we, the government, donors, the international community as a whole needs to focus on this. Otherwise, the next few years are going to be even more painful than the past couple of years.
Yeah, we've published a lot about health professional shortages in the US and Health Affairs. I'm wondering, what are some of the key strategies? Are they to increasing the workforce? Are they the same globally as they are in the US?
I can talk more about globally than in the US. We put an article actually in the Health Affairs a couple of years ago talking about a Marshall Plan for health workers. We need some kind of a Marshall Plan for health workers globally. There needs to be an investment in education across the globe, but also there needs to be an investment in what we pay health workers. I mean, you see a lot of health workers that are doctors and nurses that end up working for another organization as drivers simply because they pay them better than what they make as doctors and nurses. How can we do that? So we need to invest in their income. We need to make sure that actually they have enough revenue to be able to afford to live comfortably. We're not asking anybody for doctors and nurses to become super rich, but comfortably be able to send their kids to school to feed their families, and making sure that this doesn't take place in one country only. This is something that needs to happen across the world, because if we focus on one country, another country will be a magnet. A country with money will be a magnet, and it will suck up all the talent from that country. We need to really invest, have a global plan focusing on what is short, what kind of skills are needed, and how can we address it immediately. Again, We cannot train doctors overnight, but we really can improve the skills of some doctors and nurses and nursing aides in many countries, and focus on, physician assistants, focus on nurses, focus on midwives, until we have new doctors or new graduates as doctors. It's something that we're feeling every day, and the shortage is just getting worse every day.
As a reminder, if folks have questions, you can put them in the chat or raise a hand, and we could even let you unmute and speak directly. So what are some of the ways you've seen the field you work in, global health and humanitarian work, evolve, and where do you think it's going in the future?
Thank goodness it's evolving. And the question you asked about localization of aid and decolonization of aid, that's a direction that finally we're heading towards. We are using more and more technology, which is critical. I mean, there's so much that you could do with technology. I mean, look what we're doing now, right? And we've learned that because of COVID. We've also learned how to deliver trainings, using platforms like Zoom or Teams during COVID throughout the world, and there were effective trainings. We need to take advantage of technology and make sure that we embrace it for training, for service delivery, for continuing medical education globally. We need to be working closer together. I mean, the NGO industry is known to be competitive, and competition is a good thing because you'll get better results and better outcomes. But we do need to be working together, closer together, to really make sure that we have the maximum impact with the least amount of money that we spend. Finally, I think one thing that we need to focus on is, and many of my colleagues at Project Hope have heard me say that, and I'll say it again at the risk of them chuckling, resilience. Human resilience is something that is amazing. And I've seen that in Ukraine and in Ethiopia and Nigeria and every country that I visit. Humans are survivors. Health workers are fighters. They fight every day for us. And this is what makes me wake up every day and do the work, because I know we will get through this. I know we'll get better. And our job is to support them. Our job is to make sure that they have the tools that they need to continue that fight, and we'll overcome. I mean, there are a lot of challenges out there, but also the future is bright if we continue focusing on what the priorities are and keep pushing towards them and never take no for an answer.
Yeah. Here's a question I love. If you could give one piece of career advice, what would it be? Take risks,
take a chance. Sometimes we tend to overthink things and not follow our gut. If I continue to overthink things and not follow my gut, I would still be doing engineering work. With all due respect to engineers, wonderful people, but I wouldn't have been here, and I love what I do now. Take a chance. Sometimes you have to jump into the unknown, so be it. If it's meant to be, it'll happen. Just never take no for an answer. Take a chance, keep changing, keep evolving. The world around us is evolving, evolve with it.
And I'll ask one last question. What career or personal goals would you like to achieve in the next few years?
Jessica, I'm old. How much longer am I gonna go? I really would love to see Project Hope get to a place where it becomes the most influential global health organization in the world, because the work that we're doing and what we believe in and our focus is tremendous. But at the same time, I would really like other organizations to follow suit, and for donors to work closer with organizations as partners, not just as a donor and a recipient, where we have money for this, you either implement it or not. We need to be identifying goals together. We need to be identifying needs together and come up with a joint solution with the community and the host government at the center of it. We cannot do anything without them. I think over the next few years, I'm going to continue working on this. I'm going to continue working on really evolving and shaping the aid industry, knowing that I'm just a very small player in this field, and there are people that are much smarter than me. But I'll do what I can. if each of us, do what we can, we will make a difference. And that's my goal until I retire, if I ever retire.
And I know I said that was the last question, but we had one on the chat that I think is a great question. Seeing what you see, it does take a toll on mental health. So how do you deal with the emotional toll of everything you see, and how do you keep going emotionally?
Wow. That had to be the last question, right? You had to throw that at me. I mean, many of us have seen things that humans shouldn't see in terms of suffering, in terms of death, in terms of what's going on in the world. But people rely on us. One of the doctors in Ukraine told me, please don't let people forget about Ukraine and what's going on in Ukraine. That was his only request. And if we give up on them, we've given up on this doctor and all the patients that they treat. I have a great support system. I've got an unbelievably supportive family who understand and love, or at least they tell me they love what I do. But I can always fall back on that support system. I have amazing colleagues. And I mean, everybody in this organization, I can go and talk to them and share with them what's going on. And this really helps. I mean, if you don't talk about it, if we don't talk about what we see and some of the suffering that we witness, we can't get over it. I mean, one of the basic things for counseling is for you to talk, right? And I find that in my colleagues and my friends and my family, and each one of us should have some kind of support network, whether that's a professional network of counselors or friends and family. And believe in the work that we do. And I'll tell you a quick story, if I may, Jessica. When I was in Haiti after the first earthquake in 2010, I was working with a doctor who's been treating patients from 6 o'clock in the morning until 10 o'clock at night. And one day we came back to a tent because houses were not safe, so we're sleeping in tents. And I saw him, he was crying. And I asked him, I said, what's going on? I mean, you're crying. He said, there was one kid that if I had the right equipment that I had in the US, I would have saved that kid. And he was devastated. He wanted to pack and go home. And his name is Paul. And I asked him, I said, Paul, I mean, how many kids did you treat today? He said, about 120. I said, how many you lost? He said, one. And I told him, I said, why are you focusing on the one you lost instead of the 119 that you saved? And that's a coping mechanism that we do in this line of work, that we will always lose people. We'll always see suffering. But at the same time, you see survival. You see people moving forward. You see people trying to live their lives as much as possible. And for me, that's the biggest coping mechanism for what I go through.
Well, thank you so much for joining us today. I'm very grateful to you for taking the time to talk with us. And if folks like this professional development session, visit healthaffairs.org to sign up for other upcoming events and join our email list to hear about them as soon as they are announced. And join Insider, our new membership program, for full access. Health Affairs has a whole new slate of events coming in July. Some are open events and some are for Health Affairs insiders only. So we have an issue briefing on our July journal cluster on type 2 diabetes, a lunch and learn wrap up of healthcare related decisions from the Supreme Court, a policy spotlight with former New York City Health Commissioner Dave Chokski, and of course, the next in the professional development summer series, Capturing the Forefront, where my colleagues Rob Lott and Chris Fleming will talk people through the Forefront Publishing Journal. And with that, thank you all for joining us, and we are adjourned.